Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Good evening. Happy Friday, April the 3rd. As of Thursday evening, the CDC reports 239,000 confirmed cases and 5,443 deaths in the United States. This represents a 12% increase in cases and 21% increase in deaths from the previous day. The case fatality rate is 2.27%. As of this afternoon at 1 p.m. Eastern, Worldometer reports 259,000 cases and 6,605 deaths. Data from the Financial Times shows that the rate of new cases continues to increase in the United States with more than 20,000 new cases per day. Japan, which managed to keep the outbreak at bay in the early stages, is now seeing a steady rise in cases, although at a much slower rate than the European countries. The rate of new cases in Spain and Italy continues to decline, which is good news. In the U.S. this morning, Governor Cuomo of New York announced that he would sign an executive order giving the state the power to seize and redistribute medical equipment from private sector companies or hospitals with lower needs. The case count has now surpassed 100,000 cases in New York alone. At 2,935 deaths, the state's death toll has nearly doubled in the last 3 days. 563 deaths were reported in the past 24 hours, the highest daily record in the country. New York accounts for 45% of the United States coronavirus-related deaths. This announcement of an executive order to seize medical equipment may at first blush seem kind of un-American and undemocratic, but I would just encourage people to maybe stop thinking about the cases in New York, but start thinking about all of us as one. We are New York, and we're all going to need help in the future, and I think we really need to potentially redistribute and do everything we can to help these hotspot areas. We're all going to need the help in the future. Ventilators and personal protective equipment are not the only medical supplies that are in short supply. The New York Times reports that hospitals across the country are also beginning to report shortages of medications needed for ICU patients in respiratory distress. These include sedatives, antibiotics, antivirals, and drugs that help keep airways open. All standard medications for ventilator management, preventing secondary lung infections, reducing fevers, managing pain, and resuscitating patients who go into cardiac arrest. The Defense Department announced that it would be loosening its restrictions for civilians to be treated at its medical facilities, including the 2 naval ships that have docked in New York and California. This comes in response to criticism that restrictions were preventing the facilities from being used effectively during the pandemic. The 1,000-bed hospital ship in New York was intended to relieve pressure on local hospitals by accepting non-coronavirus patients. Since it docked on Monday, it has only admitted 20 patients. Hopefully, this new announcement from the Defense Department will change that for the better.
We've got a single question that I wanted to answer. It was, is it safe to give blood during the coronavirus pandemic? As many of you know, there is definitely a blood shortage going on right now. So it is being encouraged that people go and donate blood. In regards to the question, is it safe? It's likely safe. I would wear a mask. You always run a risk of being exposed when you go outside, but certainly giving blood is something that's extremely meaningful right now. In terms of is it safe for to receive blood or to transfuse blood, there was actually an article just recently released by the University of Milan called "The Impact of the SARS-CoV-2 Outbreak on the Safety and Availability of Blood Transfusions in Italy." The article reviews screening strategies used in Italy during their severe portion of their pandemic. Blood donation actually increased by a small percentage, and they use mostly screening questionnaires in order to avoid transmitting infection, and effectively collected enough blood for asymptomatic donors to fulfill their increased demand. And they had, at least they stated in the article, there's no significantly documented evidence of the transmission of coronavirus infection through the transfusion of blood components during previous epidemics. In other articles, there was a new article that was just recently released. It was a small trial that found that hydroxychloroquine was not effective for treating coronavirus. So the name of this trial is "No Evidence of Rapid Antiviral Clearance or Clinical Benefit with the Combination of Hydroxychloroquine and Azithromycin in Patients with Severe COVID-19 Infection." This was published online on March 30th in the French medical journal Medicine and Infectious Disease. This is another small study from France. This one was of 11 consecutive patients. This was an observational trial, so there was no randomization and there was no control. They just basically gave 11 people hydroxychloroquine and azithromycin and then watched to see how they did. They say that there was no change in their outcome or in the viral load by performing swabs on the patients 5 to 6 days after treatment and finding that 8 out of 10 of them were still positive based on their swab. So this is hard to really state that there's any true correlation here. I mean, this is such a small study. There's no control. I think we're still in a place, Matt, where we don't know the answer. Does hydroxychloroquine really work or not? We've got some literature that are in small studies that suggest that it does. We've got some smaller studies that suggest that it doesn't. It certainly has side effects. Those side effects are minimal if you're healthy, but if you're on multiple other medications, as we've mentioned on our previous podcast, it's something that definitely needs to be monitored by a pharmacist and a physician.
Yeah, and when we very first reported on the small study showing some benefit, we made the point that it was small and it didn't answer the question. And we would say the same thing about this one. It's small. It's another data point. It's important to note and to talk about, but it doesn't answer the question. And the question, the best question may not be, does hydroxychloroquine work for COVID-19? The question may be, in which patients does it work and which does it not? I saw this study earlier today and I just skimmed it. I didn't get to really dive in deep, but what I noticed was this was for very sick patients. And the last study, the first one that was a very small one and showed some benefit, was in very mild cases. So I'm not saying that it doesn't work in severe and it does in mild. Neither of these are really answering that question, but that could be it. It could be that for some subset it works and others it don't. Until we get more data points, and more studies, we're just not going to know the answer to that question. But I'm glad people are still doing the studies. Every study that comes out, we get kind of closer to an approximation of the truth, which is all that science is. We're just trying to get closer and closer to an approximation of the truth, and we're getting closer.
If I could just beg the researchers to do a randomized controlled trial on this, that would be awesome, so that we can quit going over these small case study case reviews. Just even just a controlled trial would be a nice step up.
Well, I think some people are doing that. It's just
right. They are.
Everything is so time dependent and it's expensive and more difficult.
Certainly.
So hopefully that data will come out soon.
Certainly. You're certainly right. In another study that I thought would be interesting to bring up, this one is on aerosolization of viral particles and bacteria during flushing. So our research team sent us this one, I think after our conversation the other day on wearing masks and using the toilet. I don't know if you remember that conversation, Matt, but Dr. Stone made a great comment that we really don't know whether these viral particles that can be released and aerosolized when you flush the toilet, whether they are actually infectious or not. That is totally true. They've gone through your gut. They're coming out the other end of your gut, and it's possible that they could be non-virulent once they get aerosolized. But this was an interesting study from 2013 called Lifting the Lid on Toilet Plume Aerosol, a literature review with suggestions for future research. And this was a review of the literature on toilet flushing and aerosolization of viral and bacterial particles. And they basically proved that, yes, when you flush the toilet, there are viral and bacterial particles from your stool that are shot into the air in aerosolized form. So it does stand reason that viral COVID-19 particles could be shot into the air and aerosolized when you flush the toilet.
Hey, Mike, can I tell you a secret?
Yeah.
Our research team didn't add this one. I saw it today and I added it mainly because I just want to say I told you so to Mike Stone. No, I don't think we can really make much of this. And honestly, I worry about talking about it because it's kind of a sensational headline that's scary. And I don't think you're gonna catch SARS-CoV-2 by going in a bathroom and aerosolized feces. But I mean, put the lid down before you flush. I guess it's some good advice, but don't. This is not meant to be scary. It was just kind of an interesting headline that I had to throw in there after our discussion the other day.
No, I appreciate you throwing it in there. And I don't think it's not worth talking about. I mean, I know it's a little sensational, but realistically, there's also that study out of Nebraska that I mentioned where there was high levels of viral particles in the bathroom. And that was shown in a study coming from China as well. So while we don't know whether you're going to get infected by those particles, keep in mind that that's a potential area where there may be more viruses in the air.
Okay, so per Dr. Mallon, just hold it until the pandemic's over.
Exactly, you'll be fine.
So we want to end today by talking about something that just kind of came to our attention a few days ago. It was kind of surprising. I got a text from actually a few different people all on the same day, ER physician friends of mine, who all texted me that they had their pay cut dramatically, which was interesting. One of them actually texted that he was on his way to a shift and he found out that his pay was being cut in by more than 50%, which is interesting, and because he's on his way to a shift that was going to be 10 times more dangerous, and he was going to get paid less than half to work that shift. So, to be very clear, we're going to be completely fine. We are very blessed as ER physicians. We still have a job when many people in the country don't. But it got us thinking about physicians in general. And we've been talking about supporting frontline providers, firefighters, paramedics, nurses, techs, and others. And we realize that there are a lot of physicians out there that are kind of hurting too. The ER physicians, they're having their pay cut. That's not as big of a deal as a lot of primary care offices and people in private practice whose practice has completely dried up. They probably made more pay in 2019 to qualify for some of the rescue money, but at the same time, they're leveraged. They've borrowed money. They had kind of a low margin, high volume practice, and now that volume is gone and they're going to go out of business. So physicians are not the group hurting the most in this, but as physicians, we feel like we are in a position to potentially help. So just today, we have decided that we do have the Wild Health Fellowship that we were launching July 1st, and that was intended to teach physicians how to be great clinicians using precision medicine and genomics, kind of combining functional medicine and genomics. But we are going to kind of create a tribe and a group, kind of a mastermind within that to help physicians not only improve their clinical practice and provide optimal care, but also figure out how to do it in a financially sustainable way and to be able to take care of their family and not worry about that side of the business. We don't get business training in medical school, and we think we can do this and help other physicians and maybe cutting costs, being more efficient where they can. So if you're interested, if you're a physician and you are struggling, you've gotten hit with this financially like others have as well, if you want to join our tribe and kind of be a part of that mastermind and that group that we'd like to create and kind of share best practices, you can start by going to the wildhealthfellowship.com, put your information in there, and we're going to collect everybody's information that way to start. And then in the near future, we're going to organize this group a little better and just try to help and support each other. This is a time where, as a country and group physicians, we really need to be there for our patients, but as fellow physicians, we need to be there for each other as well. So we don't know exactly what that's going to look like, but we do feel like we have a large group of very smart physicians that we work with, and we all should be sharing. So if you want to be a part of that, go sign up at wildhealthfellowship.com, and we'll give you more information about that. If you're not a doctor, sorry for that brief interruption. If you want the most cutting-edge COVID information in the world, make sure you tune in this weekend, for the Wild Health Summit. It's completely free. You can register at wildhealthsummit.com. David Sinclair, Ben Greenfield, Andrew Weil, Scott Weingart, Rob Warman, and who we consider to be the top healthcare experts and doctors that we respect the most, talking about treatment, testing, immune optimization, and all of those types of things. So wildhealthsummit.com. Tomorrow morning, Dr. Mark Goodman on the podcast is going to be discussing exercise during the pandemic. And then in a few days, tune in to hear an interview that we just recorded with an all-world NBA star, DeMar DeRozan, on mental health in the time of a pandemic.
All right. Thanks, Matt. Stay safe. Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.